versatile, quality of life getting better.
Hi guys, welcome to today's interview. And you know my name, right? You already know my name if you are familiar with this kind of program that we've been doing for the past 2 weeks. Okay, my name is Obotolani Olajumoke Falaye from Positile Limited, and today I'm with a colleague of mine. You're welcome, sir. May I know your name?
Yeah, Mojola Oluwamijo is the name, and it's nice to be here again.
Alright, you're welcome, sir. It's nice to have you on the interview. And today we'll be discussing about tuberculosis. And I would like to ask you, what did you understand about tuberculosis, sir?
Tuberculosis,
Yes.
TB. A lot of people are not familiar with what it is, but from now, tuberculosis is an infectious disease that often affects the lung, and it is caused by a type of bacteria called Mycobacterium tuberculosis. It is spread through air when an infected person coughs, sneezes, or spits. Then tuberculosis is preventable and curable.
All right. We've been talking about tuberculosis. Do you believe it can be transmitted?
Yes, affirmatively. Tuberculosis, TB, can be transmitted. It is transmitted. No. It is spread through an aerosol, which is a tiny droplet expelled in the air when an infected person coughs, sneezes, or spits. And also in a poorly ventilated room where there are many people. Once an infected person coughs, the bacteria is being expelled into the air, and it can stay in the air for hours.
Wow.
And and it's also transmitted to the consumption of unpasteurized milk, cheese from infected cow. They are also a vector of the disease, so they can actually disseminate it. So those are the ways whereby it's transmitted.
All right, thank you for that, sir. And what kind of symptoms a person with tuberculosis may have, or the signs that the symptoms might be given? Because we need to know the symptoms that tuberculosis can give to someone before they seek a medical attention.
Okay, these are the symptoms of tuberculosis. We have chronic cough, and after the cough, there is a production of a thick sputum. Yoruba call it kelebe. It forms after the coughing. Then it's characterized by weight loss, drenching night sweats, and mild fever. There are some other ones, but these are the obvious ones that you would notice when you have a patient suffering from TB.
I would like to ask you, since these are the symptoms associated with tuberculosis, what are the do's that you would like people to know about this disease?
Yeah, most times when we say something, we say stay safe out there. So the do's to stay safe. We have coughing etiquette. Now, these do's goes for a person suffering from it and people in the environment to avoid spread and to avoid contacting. So the first one, I call it cough etiquette. There's a right way to cough. You don't cough into the air. You cough into a tissue or an handkerchief away from people. You divert your mouth when you're going to emit anything from coughing away from people. So use the coughing etiquette. Then ventilation. Stay in a well-ventilated room. If you see a room of over 50, 100 people, it's not very ventilated. So avoid. So if you have TB, avoid overcrowded area. And when you're not overcrowded, just find a way to protect yourself.
All right, because it is transmitted.
It is transmitted.
Another person can actually get it.
And healthy diet. Before I mentioned this, I mentioned that this bacteria can stay in the air for hours. So anybody can just get it from there. So just avoid putting it out there in the air.
So what would be the way forward to that kind of thing?
Use the handkerchief, your face masks is always very helpful. Then healthy diet, consume healthy diet, meals that boost your immune system. Your immune system helps you to fight all of those things. So then there is a vaccine called Bacillus Comtegoin, BCG vaccine. Ensure you and your family receive such, and it helps you to provide protections against TB. Then medical consultation. So when you notice a chronic cough or an irregular cough, just see a doctor. It's always the best.
People used to engage in some kind of thing. What I will call self-medication.
Self-medication.
Yes, you'd be like, let me go and meet the Ashakra chemist where they and then give me this thing. They didn't even diagnose them for that kind of thing. They just notice some kind of symptoms.
I'll put it out there that self-medication is wrong in all of its course, in all of its ways. It is nice you get diagnosed on time and get treated with the right medicine, not you just thinking of this will cure it and just put it out there and use it. And the medical compliance, strictly follow the prescribed anti-tuberculosis regimen given to you. Now the treatment lasts for about 6 months. Don't cut it along the way, finish it. This is essential for health and it prevents the spread of TB.
Alright, okay, for someone that already has the tuberculosis, or some that didn't even have probably they didn't have the tuberculosis, what are the ways that you think the don'ts that people shouldn't engage in to get in contact with this kind of disease out there? Or someone that already have it, what are the preventive measures to take, the don'ts they should get involved in?
Yeah, thank you for that question. That would make me put some of this to help our people. They said neglecting symptoms. Nigerians, we neglect our symptoms. We just see it, and then someone said don't search your symptoms online. but then don't neglect your symptoms. When you notice something, for example, the symptoms I mentioned, the persistent cough, the fever, the weight loss, the night sweats. When you notice all of those things, just seek medical attention. Be inquisitive to know about what is going on in your body, so that you'll be able to undo anything on time. This goes for different things health-wise. And avoid self-medication, as I've said earlier. Go for proper treatment. Then when you notice that you have TB, or you are just on treatment for it, avoid the sharing of utensils. Talking about spoon, cup, plates, so that you don't drop the materials on it and someone else pick it up
and get it
again, and you start the circle. Save your loved ones, protect them. Then don't delay medical attention. Once you get a hold of it on time, you easily beat it down before it starts to give you so many things. Then don't stop the treatment prematurely. I mentioned that the treatment goes for about 6 months. Don't just stop it along the way and be like, hey, I think I'm fine. No, make sure it is completed. Complete that chain of treatment.
As it was prescribed by your healthcare provider.
Always complete your medication as prescribed for full recovery and prevent drug resistance to TB strains. Thank you.
All right, thank you, sir. In short, what advice would you like to give people how they are concerning this type of disease?
From the Yoruba side, they see an adage that says "Oku kin fara pamo feni to masi." That is to say, get help. Don't keep it to yourself.
All right.
TB is a serious infectious disease because it is transmitted from one person to another easily. But it can be managed and treated promptly with medical attention. Emphasis on with medical attention, not self-medication, and strict adherence to prescribed treatments. Then for an healthy living, follow the do's and don'ts, and help prevent you and others to make our world a better place to live and make our ear a pure one to breathe in.
Alright, thank you so much for this. I really gained a lot. I would like to tell you about Positive. Positide, you can register on our platform at www.positide.org.ng as a client for free or as a service provider for 1,650 naira. It's so cheap. Monthly for monthly subscription package for full virtual office assistants and package which offer full virtual office assistant product service cataloging and sales plus networking. And you can also download the Positide app for free on Google Play Store and drop questions for the Positide doctor for free in the chat room. You can also contact the front desk officer with this number +2347038338723, or you can also email us at info@positide.org.ng. Positide, quality of life getting better. Thanks for listening.
Positide, quality of life getting better.